Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Qelbree Viloxazine vs Strattera Atomoxetine for ADHD. Multiple treatment options are available for managing attention deficit hyperactivity disorder, ADHD, including stimulant and non-stimulant medications. Qelbree, Viloxazine, and Strattera Atomoxetine are two examples of non-stimulant ADHD medications. /r/n/r/n Both Qelbree and Strattera are serotoninnorepinephrine reuptake inhibitors, SNRIs. They help increase levels of norepinephrine and serotonin, two chemicals in the brain, to manage ADHD symptoms like impulsivity, inattention, and others. /r/n/r/n Though they work similarly, the two have a few differences, particularly in dosing and administration. Unlike Strattera, Qelbree is available in an extended-release formulation. /r/n/r/n/Getty images, Vince TalottaContributorrnrn/r/n/r/n Qelbree, Viloxazine, is a medication that can help manage ADHD symptoms. It belongs to a class of medications called SNRIs. Strattera Atomoxetine is also an SNRI that can help manage your ADHD. /r/n/r/n These medications work in the brain by stopping some of the breakdown of norepinephrine, which helps with learning and memory, attention, and mood, and serotonin, which helps regulate mood, behavior, and attention. Preventing the breakdown of these chemicals helps boost their levels in the brain, which might help manage symptoms. /r/n/r/n Stimulants are considered the first-line treatment option for ADHD. They work by affecting the amount of dopamine and norepinephrine in the brain. Examples of medications that are stimulants can include :r/n/r/n Non-stimulant medications are often taken when stimulants do not work. Unlike stimulants, non-stimulants do not have a risk of misuse and dependency. Examples of non-stimulant medications include :r/n/r/n The following table compares the main differences and similarities between Strattera and Qelbree. /r/n/r/n Both medications have proved better at treating ADHD than a placebo, a medication that looks like a normal tablet or capsule but has no therapeutic effect. /r/n/r/n In one small trial of 50 participants, those who switched from treatment with Strattera to Qelbree showed greater improvement in their ADHD symptoms, such as inattention and hyperactivity. However, this study was an open-label opt-in trial, which may have affected the results. /r/n/r/n Both medications carry a box warning for a serious risk of increased suicidal thoughts and ideations. Signs of needing to alert you or your child's healthcare provider may include sudden mood or behavioral changes when starting or changing the dose of your medication. /r/n/r/n Common side effects of Strattera can include /r/n/r/n More rare but severe side effects for Strattera included /r/n/r/n Common side effects of Qelbree include /r/n/r/n More serious side effects of Qelbree can include /r/n/r/n Do not start Strattera or Qelbree if you have had a hypersensitivity reaction to either medication or their ingredients. /r/n/r/n Before starting Qelbree, talk to your healthcare provider about /r/n/r/n Before starting Strattera, talk to your healthcare provider about /r/n/r/n You should not take Strattera if you have or have a history of the following /r/n/r/n Because Strattera and Qelbree are non-stimulant medications, their risk for misuse is not commonly compared to other medications taken for ADHD treatment. /r/n/r/n Studies have shown that Strattera is not habit-forming compared to a placebo, a drug that has no active ingredient in it. You can abruptly stop taking it if your healthcare provider requests this. /r/n/r/n medications broken down in the body by an enzyme called cytochrome 1A2 can stay in your body for longer than intended when taken with Qelbree because Qelbree will make them break down at a slower rate. /r/n/r/n examples of these medications include /r/n/r/n if you are taking Strattera, certain medications can cause interactions and unwanted side effects. For example, /r/n/r/n stimulants are commonly prescribed as first-line treatments for ADHD. However, some cases may call for non-stimulants instead, such as /r/n/r/n Qelbree and Strattera work similarly, and little research exists on whether one is more effective at managing ADHD. One benefit of Qelbree over Strattera is that the capsule can be opened and the contents sprinkled onto pudding or apple sauce, whereas Strattera must be swallowed whole. Therefore, if you or your child have trouble swallowing pills, Qelbree may be a better option. /r/n/r/n However, Qelbree has no generic option, so it will likely be more expensive. For this reason, insurance companies may be more likely to cover Strattera before paying for Qelbree. /r/n/r/n Qelbree and Strattera are non-stimulant medications that can help manage your ADHD symptoms without the risk of abuse and dependence like other ADHD medications. They are both SNRIs that are thought to work by targeting certain chemicals in the brain to help regulate behaviors associated with ADHD, like inattention and impulsivity. /r/n/r/n Qelbree and Strattera both offer similar benefits in that they are not habit-forming and do not have the same kind of side effects as stimulants. If you can't swallow pills, Qelbree may be preferred because you can open the capsule and consume its contents with food. Insurance coverage may also factor into which medication you take. /r/n/r/n Discuss your medication and health history with your healthcare provider to find out if either medication is right for you. /r/n/r/n The author would like to thank and recognize John Candelaria for contributing to this article. /r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.